Good afternoon, everybody. I am Megha, Healthcare Data Analyst at Center for Improving Value in Healthcare, or CIVHC. I am here to present and talk about one of my projects, gender-affirming care in Colorado, considering nuance in politically charged data releases. So, CIVHC is an administrator and custodian of Colorado All-Payer Claims Database, or COAPCD. Here is a brief overview of what's included in COAPCD. Medical, pharmacy, and dental claims, data from 2013 to 2022, totaling more than 1 billion claims, around 14 commercial payers, plus Medicare and Medicaid. We estimate our database covers more than 70% of covered lives in Colorado for medical claims. What is not included in CAPCD are federal programs such as VA, TRICARE, Indian Health Services, ERISA-based self-insured employers, and uninsured self-pay claims. How does CIVHC serve the community using COAPCD is through public data as well as non-public data. Public data incorporates our interactive reports and publication on our website, which is easily available for anyone to use and download the data. Non-public data are usually custom projects based on specific needs of customers. Some of our focus areas are community engagement, advanced care planning, palliative care, and research and evaluation services. So the background of this project, gender-affirming care, it is typically refers to care received by a person whose assigned sex at birth does not match gender identity. This can include social, economic, emotional, behavioral, and medical care, and encompasses anything from using a person's pronouns to social support to gender confirmation surgery. Gender-affirming care is common among gender diverse, transgender, and non-binary individuals, or TGDNB individuals. Some background about this project. In 2017 being an important year, when Colorado Department of Healthcare Policy and Financing Medical Services Board passed a statute for comprehensive Medicaid transition-related care benefit. In October of 2021, Colorado became first state to require comprehensive gender-affirming care as a part minimum or benchmark for healthcare plans sold on individual and small group markets. And commercial payers are required to comply to this by 2023. The goal of this project's analysis was to understand the utilization of such gender-affirming care services in Colorado over time by different health insurance payers. So initially, CIVHC engaged with multiple community partners to ensure the perspective of LGBT advocates was heard and considered in release of the analysis. Analysts consulted with Colorado advocacy organization One Colorado to make sure all concerns or considerations were taken into account, and data was released in accordance with the standards of the community. Additional resources which were used or where we had done some of our literature review were One Colorado's Closing the Gap report, the Trevor Project, and Human Rights Campaign gender-affirming care resources. So what's included in the methodology? It includes medical claims of all Coloradans from 2016 to 2021. All types of claims were included: professional, inpatient, outpatient, having ICD-10 codes of gender-affirming care, which were mostly F66.X. ICD-10 codes included in our COAPCD were about 10 to 11 of the codes. Please note that there are concerns that ICD-10 codes for such care are narrow and create barriers for those seeking care. The payers which were included in the project were commercial and Medicaid. And the population of the project was divided into two subgroups: 17 years or younger, and young adults, which were 18 years to 24 years. Analysis included were volumes of claim per year, rate of distinct people per 100,000 covered lives in COAPCD, median allowed amount per payer per year, age 17 years or younger, or age 18 to 24, and race and ethnicity was also looked into, where we included all years data. So the findings. This is the finding about average allowed amount by pair. The x-axis shows us year, while y-axis shows average allowed amount per service. What is a service? Service is a COAPCD member having a claim with a distinct provider on a specific date of service. As you can see, since 2017, average cost per service for Medicaid has remained around 300 to 350 per service, while we see an upward trend for commercial payers, which increases from 570 to about 662. Moving forward, these are the trends of claim volumes by age and payer. As you can see on the left, Medicaid, there's a consistent increase. Commercial shows the same trend, but the amount of member count, the claim counts were considerably lesser. Among usage among adults, young adults is higher, as you can see. The assumption here is that they become independent at this age and utilize more of such services. Race and ethnicity data. Since most of this data is voluntary, we see quite a bit of variation in against Colorado's census data. Although WISE has highest percentage of 38 here, but they are quite low compared to 61% in general population. Secondly, as you can see, non-Hispanic or Latino unknown race and unknown race and ethnicity constitutes to about 27 and 5%, which is the second largest group here. Data is collected for these race and ethnicity through the guidelines given by Office of Management and Budget, or OMB. It's based on self-identification. As you can see, the percentage among Asian and Blacks are also low compared to Colorado census data. Findings and insight. The number of individuals receiving gender-affirming care in Colorado rose from 300% from 2016 to 2021. While this was a significant rise, but it only represented 0.01% of people covered in Medicaid and commercial. Increase attribute to the change in coverage requirement, not an increase in the number of people needing care, but rather than increase in the number of people getting access to these essential services through their health insurance for the first time. Impact and the data outreach, lot of public interest in this data. As you can see, more than 100 plus data downloads from our website, and there was media total outreach of about 602,000. There was also a public news service about reports finds Colorado a leader in access to gender-affirming care. Challenges for these projects were quite a few, such as data sensitivity and compliance with data release, misconstrued data sharing and communicating, which codes to incorporate in such a study. As you can see, it's very narrow. There were also quite a bit of lessons learned, like community engagement with different partners, lot of literature review and source review, use of external resources to contextualize data which was shared, and other limitations and scope and proper utilization of F64 codes. So, and that's all, folks. If you have questions or feedback, please feel free to reach out to me at mjha@civic.org. You can also stay connected with Civic on Facebook, LinkedIn, and Twitter by joining our email list at www.civic.org. Thanks so much for your time and interest. Hope to hear soon from you guys. Any questions?